Hello, I'm Dr. Kirby Thompson, licensed naturopathic doctor and acupuncturist, owner and operator of Wildflower Wellness, Hattiesburg, Mississippi. And we are so glad for you to be joining us for Dr. Kirby's Pick, October 2022. Hey, please like, share, and follow us. We love to give you information. We love to help you with your health, and we love our patients. We understand that health is one day at a time, and it is an overcoming mindset that you have to keep up with what's going on. This month in Dr. Kirby's Pick, we are focusing on blood work. I was talking with a colleague of mine a few months ago. He discussed with me a person that had been to see him that had recently had a heart attack. That person actually had blood work every 6 months. Come to find out, when they looked at the blood work, it was just regular blood work, CBC, CMP, lipids. Those are great things to keep up with if you look at them for trends or to be optimally out or functionally out of range, because those can lead you in different directions to make sure you're working on someone's inflammatory profile. However, if you go to the doctor for wellness, your insurance company most likely is not going to cover those tests that actually show the inflammatory patterns of your body. So it's really important to make sure that you are keeping up with your health, that you are requesting some tests. And if your insurance company doesn't cover it, remember, you're in charge of your health and no one else. It's up to you to do it. A personal responsibility for us to take charge of our own health. We have to pray first, then seek the doctor. So it is important for you to study to show yourself approved unto God. A workman need not be ashamed, right? As a healthcare practitioner, to help you to be educated. So what we're doing this month in our social media is we are covering some tests. Now, there are more tests for sure, but these tests that can help you in your awareness of your actual health status. So the tests that we've chosen are homocysteine, CRP, CK, LDH, ESR, ferritin, C-peptide, A1C, ceruloplasmin, cystostatin C, and complements. Excuse me for any pronunciations that I may not have, because I am from Tennessee, and that's just how we talk, and we love how we talk in Tennessee. So, these things we talk about there's actually a post for each one of these on our social media this month, which we'll be finishing up. But let me call your attention to a few that are really easy to talk about. For example, ferritin. Ferritin is one of your markers that is elevated first when getting a fatty liver. You can have perfectly normal liver enzymes. However, if that ferritin is up, bam, you got inflammation. You could have a fatty liver. Ferritin is an acute phase protein. Ferritin is also decreased in anemia. So even if your iron is up and your ferritin is down, you may have anemia. Many things, one test tells you a lot, but it's actually the totality of the test and how they actually, this is high, that is low, how they work together in order to give you a full picture of where you are in your health. So another one is the A1C. A1C is a great marker for your long-term sugar control, okay? And it should be no more than 5.8. A lot of people say that, it's below 6.2, you're doing good. But remember, things can be too low and things can be too high. And you want to be optimal, not just standard. Who wants to be standard? So make sure you're getting that checked. Another one that I often check is the ESR and the high sensitive CRPs. Those are going to be great markers of inflammation. They are all acute phase proteins. Remember, acute phase proteins are secreted by the liver for inflammation and infection. So make sure you're getting that done. Another one that we're going to cover in the next week or two is called complement. Complement are actually proteins that are used by the immune system in order to help you. And it is a great marker of where you are. For example, complement C4A is a great marker in leukemia. Did you know that? No. Complement C3A is a great marker for viral and other things. So when I was living in fungus for 3 years, my natural health care practitioner suggested I do a complement. I think that's a great thing, especially if you have a lot of health problems and you don't know what's going on. You need to make sure that you're seeking some help. Now, one more I'd like to try is the ceruloplasmin. Now, ceruloplasmin can help you find out if you're deficient in copper. Remember, a lot of times when you're having anemia, you may be iron deficient, you may be B vitamin deficient, you may not be absorbing the iron or absorbing the B vitamins, but you may also have a problem with copper. And copper you can also have a problem with if it's too high. Very, very bad problems if it's too high. I love to do the hair analysis on patients. It allows me to see the minerals that are in the hair, but it also allows me to see any toxic minerals that may be being excreted, right? Because remember, that's the hair, that's what's growing long term. But the ceruloplasmin. And I'm going to read this to you from our Optimal DX. This is what we use to help our patients. What this does is it gives us a PDF report to give to our patients based on their blood work. And based on your blood work, it allows you to see what's happening in your own health. So, for example, this is what I love about blood work. The ceruloplasmin can really help you see if you're having a genetic issue, possibly. However, look here, I'm reading this directly from the program. Ceruloplasmin is an acute phase reactant and may be elevated in infection, cardiovascular disease, arthritis, and other inflammatory conditions. Elevated ceruloplasmin strongly correlates with levels of high sensitive CRP, which will be elevated, and is considered an independent risk factor for cardiovascular events. In general, elevated ceruloplasmin tends to be more common in older females with cardiovascular risks such as dyslipidemia and diabetes, as well as reduced renal sufficiency. Very important. So there are tests that you can be getting yearly, every 2 years, 3 years, that let you know if there is something going on in your health other than a CBC, a CMP, and the lipids. What we're giving you this month and every month is really just information to help you with your health, because we love you and we want to make sure that you are keeping up with what you need. So if you need help, please give us a call and visit us online. And remember, we didn't go over everything today. We went over some things, but we do have a lot of information on our social media. So we want you to like, follow, and share, and look and read and see what we're doing, what the information we've given you. And if you're our patient, ask. We are more than happy to help you in any way that we can. We pray that you have great health and a great year. Give us a call or visit us online, www.wildflowerwellnessllc.com.